Hopefully you're not getting tired of seeing me and these lives that we've been hosting. Typically, you're joining me on Monday evenings for our Ask Us Anything question and answer series with the experts for new and expecting and veteran parents. So I'll introduce you in a second. I was just saying to families, if you don't know me, I help families along with my colleague Bernadette get more sleep, tackle potty training, and by and large, our families see loads of success. But what we found over the years is that when our tips and tricks are not doing the trick, it is sometimes due to an underlying sensory issue that is making sleep or pottying harder than it needs to be. So we were so excited when Play at Home, a company that we refer families to all the time, added Alyssa and your awesome occupational therapy services and your sensory knowledge. So we added this live today so that we can talk a little bit about sensory issues and questions that families have about sensory processing. I know that I didn't find out about my son's sensory processing disorder, which is pretty significant, until he became school age and struggled for several years in school, and yet there were signs much earlier on that I can now look back to. I just didn't know how to interpret them or what they meant, or that there was even someone out there that could help. So I am on a mission to spare families the long, painful journey that we had to find out about this, and having you on today is part of that mission, and I'm really excited that you're here. Thank you for joining.
Yeah, thank you. I'm happy to join you on that mission of giving families the knowledge to, learn a little bit more about their kids and maybe some other types of interventions that might be helpful for them if you've tried all these things and there's just still something in your gut telling you that your child might be doing things a little bit differently.
Listen to that mommy gut. Everyone told me to ignore it for a really long time, and I wish that I hadn't, and now I don't. But let's tell everybody a little bit about you, and then we'll get to the questions. If anybody's watching and you have a question you want to submit, go ahead and pop it in the comments. We'll get to it today. But Alyssa is a board certified occupational therapist at Play at Home, and Play at Home provides home-based physical therapy and occupational therapy services to children birth to 5 in our greater Philadelphia area. And I have a whole long speech I could give about you, but you're here, so I'll let you do it. Tell us more about what you do before we get to the questions.
Sure. So I've always been a pediatric OT. That's why I went to OT school, and definitely what I've been doing for the past 5 years since I graduated with my master's. I've worked in a variety of different pediatric settings, and across all those settings, one of my favorite things to do is to give parents that knowledge and information, because they are the ones that are with their child, all the time. Like, they might get OT at school or at outpatient or through early intervention, but the parents are the ones who really have the power to make some awesome changes in their child's progress. So yeah, I've worked in acute care, the NICU, preschool setting, as well as early intervention, and the past year and a half, telehealth, which has been, a journey, but actually very conducive to giving parents the education that they need in their homes. And then with Play at Home, I do get to provide OT services for kids and their families in their home, where they're having issues with meal times or having issues with, whatever sensory things that might be going on, or, the parents just, want a professional to come to their home versus, driving them to yet another appointment amidst their schedule.
Sure. And I'm sure kids perform a little more comfortably and better in their home environment.
Yes, that's definitely something I've seen.
Something to be said for that. Awesome. So we will get to the questions in just a second and throw them in the comments if you have additional ones. But can you what is occupational therapy? I think a lot of parents are like, what? My kid doesn't have a job?
My kid is not employed yet. Yeah, I love that question. And I do have my little elevator speech prepared, because I've definitely explained this to current clients who still don't know I'm the OT, right? I've been called the play doctor. I've been called the teacher lady. But OT it's called occupational therapy because really we are the rehab profession that's helping your child do whatever it is that occupies their time. So for kids, there's a lot of different things that occupy their time, right? There's school, homework, academic related activities. There's just playing, using their hands to do a variety of things for themselves through play, or maybe getting dressed, brushing their teeth, feeding themselves. OT is a really, really big scope. So within OT, there's a lot of different specialty areas. And so, yeah, sensory processing is definitely one of those like lesser known areas that I think we're seeing become a little bit more talked about. I've seen lots of sensory friendly events happening in the community, which is awesome. But there's still a lot of questions I think that families have, is this sensory, or is this just my child's personality?
Yeah, for sure. Okay, great. All right. I'm sure people came for the questions and the answers. So let's get to that, and we could do some more chatting at the end, some more general chatting. The first question that we have, my preschooler is very sensitive to loud and bright environments. I read that it could be because of a sensory processing disorder. What exactly is that? And is it only seen in kids with autism? I think this is another confusing
Yeah,
thing.
it is confusing. So sensory processing, it's something that we all do, right? We all process sensory information from our environment around us, and our brain turns that into a response. So we know, it's the five senses: touch, hearing, smell, taste, and vision. And there's also 3 lesser known senses that I'll definitely cover a little bit later. Remind me if I don't talk about those. And we use the sensory information to form an appropriate motor or behavior response that sometimes we refer to as an adaptive response. So while we all have sensory preferences, right? Like I definitely don't like loud noises and I need my sound machine to sleep. I think I told you that before. I cope with that, right? So sensory processing disorder is what happens when those abilities to cope with different sensory information kind of impacts your ability to function or cope with everyday activities and situations. Mm-hmm. So for this question, loud and bright environments, I'm picturing like a grocery store, checkout aisle, things beeping, lots of bright fluorescent lighting, or like a cafeteria setting. Yes.
I'm trouble there, and I didn't know why.
So that might be an overwhelming environment for a kid who's a little bit more sensitive to deal with. So if that's resulting in tantrums, like the tantrum might not be because they couldn't get the cookies or the food that they wanted, but they might be really overwhelmed by all these like bright packaging and sounds and people. So if this is impacting the child's ability to be in, everyday settings and surroundings, then I would absolutely look a little bit more into sensory processing. There is a excellent resource that I like to recommend. It's the STAR Institute, which is a research and treatment center that was founded by an OT who was actually trained by the OT and neuroscientist who really first identified sensory processing disorder. I'm referring to Dr. Ayers and Lucy Jane Miller. So parents can absolutely check out the STAR Institute's website.
Is that SAR?
STAR, yeah, STAR. So the STAR Institute. Mm-hmm. The STAR Institute's website has a wealth of information about what is sensory processing disorder, what are some red flags to look at, how is this assessed. The second part of this question about in relation to autism, so this is really confusing. So right now, sensory processing disorder is not recognized as a standalone diagnosis separate from autism. However, we have seen clinically that there are kids that can have sensory processing disorder and not have an autism diagnosis.
We have one in our house.
There you go. Case in point. So it is something that OTs are currently advocating and doing lots of research to get sensory processing disorder included as a standalone diagnosis in the next edition of the DSM, which is really just to help insurance cover treatment. So yeah, treatment can unfortunately be expensive if it's not, if there's not this research supporting that this is, a standalone different diagnosis than autism. Now, we do see a lot of kids that have autism and a lot of sensory needs. So it can be hard to tease out.
It doesn't have to, sure.
Right.
And for parents that are in our sleep audience, I don't know that this is your specialty, but I just want families to know that ADD and ADHD are often or misdiagnosed because a child isn't sleeping well, therefore they're misbehaving and being hyper or aggressive or whatever, and it just kind of they just throw you into that bucket, right? And maybe they're not sleeping well because they have a sensory issue that also makes them behave aggressively and hyper, and it really can all be tied together. So, not telling parents to question the diagnoses, but just to pay really close attention to this information and the red flags. And if you are like, hey, my kid checks all those boxes, there could be a sensory component going on with behavior, sleep, or that type of diagnosis.
Right. Absolutely.
Cool. Okay. So I think we totally answered that first one. Ready for the next?
Sure.
Okay. Question 2. My 18-month-old is constantly running, climbing on furniture, never seems to get tired. Could this be related to sensory processing, or is it's just a typical energetic toddler?
This sounds like half of my treatment caseload right now. This is such a good question. I mean, yes, like toddlers have a lot of energy, right? And I would go back to, if the child really can't sit still, really can't focus, runs back and forth repeatedly, climbing on everything, if this is impacting their ability to play, to focus, to stay at the table during meals, then I would say there could definitely be a sensory component to this. So I would possibly assume that this child is what we call a sensory seeker, and they might be seeking sensory input in a lot of different ways throughout their day. So we talked about the 5 senses that we all know and love earlier. So the 3 lesser known senses, 2 of them have to do with movement and seeking out different movement. So there's proprioception, which is sensing your body's movement and position. There's receptors in our muscles and joints that let us know where we are in space. And then there's the vestibular sense that tells us where our head position is in relation to gravity. And this is sensed by an organ in the inner ear. So this is giving you information about if you're spinning, if you're in a car, if you're really oversensitive to this, you might get motion sickness. And the vestibular sense is very, very closely related to vision and balance. So if there is a child who is just moving nonstop, I would think that they are, craving that type of sensation that they're getting from moving. If the child is spinning around, they might be craving that vestibular sense of like their head doing more of a rotary movement. If they're climbing on things, they're also getting information about where their body is in space, just from how they're feeling when they're moving on different things. They're getting information to their muscles and joints when they're using their body in that way. So while this could be like a typical energetic toddler, if it's like a constant thing or it's really impacting ability to, focus on a task, then this would be a good kiddo to refer to an OT evaluation. And OTs.
Mom, that is so on point. Like if something stands out as unusual to you or extreme, or like I noticed, for example, my son seemed to have no understanding of personal space. Even as he got older, I would have to talk about like, mommy has a bubble. Don't come in my bubble all the time. Like, you don't need to talk to me right here. You don't need to be bumping into me when we're taking a walk. He was always like crashing, bumping, whether it was intentional or unintentional. And I didn't know if he was just trying to be difficult, right?
Right.
Know more about his issues. I think he was either seeking information or he had a hard time knowing where he was in space.
Right. So that's his body awareness, right? And you're, feeling all the crashes and bumps, but he might not be perceiving that the way that you are.
And I'm a sensory avoider, so him constantly coming in my space and bumping into me, it made me very anxious and almost angry, and we were like a mismatch in that regard. So I was like, is this weird, or am I just being weird and like overly sensitive? But it did really stick out to me. And I also noticed that anytime he would swing, like we had a swing in our front yard or a swing, a hammock in the basement, he just was like a different, anytime he was done that, he was a much calmer, more regulated person.
Yeah.
And that kind of stuck out there were just little things where I was like, this doesn't seem typical of other kids. And he is of course a seeker and also an avoider, which is a really fun combination. And I think that the thing that made the most sense to me was someone, like yourself, that described it as we all have cups. Yeah. Cups for how much sound we need or can tolerate, and cups for movement, and cups for light, and whatever. Some of his cups were constantly overflowing and he couldn't take in anymore, but some of them could almost never be filled. Like his motion cup, he was always trying to fill it. And I was like, that makes so much sense.
Yeah.
The problem for he and I is we have opposite levels in our cups. It's a difficult thing. But yeah, just to trust your mom gut, is it typical or is it atypical? Like, what's your gut telling you? You get to see other kids, and is that what you're seeing everybody else do, or how you're seeing them respond?
Right. I love the cup metaphor. I've heard that one before, and it's important to recognize there are no two kids that have the same, thresholds for what they're able to tolerate or what they're craving. Right. So there's some different sensory assessment tools that it's really important for a clinician to, do that questionnaire with the parent to really get into each single sense. Are they avoiding of this sense? Are they sensitive to this? Are they craving this? Do they not quite register this one the way that, would be typical? So yeah, it's definitely, it's interesting to see like how it plays out. But yeah, I would definitely say usually if you're seeking of one sense, you could absolutely be avoiding of another.
Yeah, exactly. Okay, good. All right, let's get question number 3. A friend suggested that I try a weighted blanket for my child who struggles to fall asleep. How do they work, and are they safe?
Yeah, so
this is talk about weighted blankets.
This has been like kind of a more like trending type of thing for not just kids who struggle with sleep, but adults who struggle with sleep. They can be very, very expensive. They are safe, so you want to take the child's weight into account. The weight should not exceed much more than 10% of the body weight. So if you have a 30-pound child, you're going to look for like a 3, maybe a 4-pound weighted blanket. You're not going to do like the standard 10-pound weighted blanket that you might find at the store. Are
we talking age 2 and above, right?
Yes. You want to make sure that also the child is able to independently remove that blanket if they want to. So it shouldn't be any type of restriction on them. And the idea behind it is that it provides like a constant deep pressure, not unlike the comfort that you would get from like a nice big bear hug or like a deep tissue massage or like a swaddle, even that like constant kind of a pressure. And that can have a calming effect on the nervous system to help just relax and wind down. Now to be transparent, there is mixed research from the American Academy of Pediatrics on the effectiveness of weighted blankets. Like in reality, like are kids actually sleeping longer or falling asleep quicker? Mixed evidence on that. But I've definitely had some good anecdotal evidence of, for kids as well as, older folks who do find it comforting, and it does kind of help with that bedtime routine.
And these would really be the kiddos that want someone laying with them, rubbing their backs.
Yes.
Or the kids create like a nest of stuffed animals and pillows.
Yeah, or like the beanbag chair, or, want to be constantly pushed up against their parent's lap, or even just laying down on the floor, feeling the weight of your body against the floor. That is also giving your body a lot of information about, where you are in space. You're laying down, you're very grounded. So I wouldn't be like, oh, weighted blanket, that's going to be like a magic cure. But there is like some evidence, and just from a sensory perspective of like why it's something worth exploring. And if you don't want to, spend all the money on like the really nice expensive ones, there are certainly tutorials of how to like make your own kind of a weighted blanket. A lot of school-based therapists will use a weighted lap pad, so kind of like a little sack or pillowcase type of a thing that just sits on the child's lap that kind of helps them focus during school.
Well, and my son runs very hot, so I was worried about spending the money and then he wouldn't keep it on him. So we actually got a compression sheet, which is a similar concept, but not
similar.
Or hot, and it is really, he says it's really helpful. Who knows?
Yeah, so it's a similar concept. The weight is different than the compression, but it's a similar reasoning behind why it could be helpful.
It'll stay settled. Yeah.
Mm-hmm.
Okay, great. Awesome. All right. My 2-year-old gets upset when his hands get messy. What are some ways to help him tolerate activities like finger paint and Play-Doh? This was my guy too. I would pay for art class and he wouldn't touch anything.
Right.
So kids like to get messy, right?
Right. So I love that this, if you're trying to encourage your child to experience different materials like Play-Doh and finger paint, that's wonderful, but you definitely want to do it in a way that keeps the child calm and doesn't have like an opposite effect, right? So if you have a child that's like a little hesitant to touch something messy, you don't want to take their hand, do the big handprint in the paint, and all of a sudden they have all this paint on their hand. You definitely want to approach that a little differently. So a general rule of thumb is the smaller the surface area, the easier it is to tolerate. So I would do like just a little fingerprint first. And I definitely think the parent has to be getting their hands messy and modeling this for the child. I meet a lot of parents who don't like to get messy themselves, and apple tree. Yes. A great way to work on this too is to pair it with a water play activity. So the child has like an easy out. If they do suddenly get overwhelmed by, oh, there's stuff on my hand, they could rinse their hand easily and maybe go back, to try again. So an example of this could be, I just did a session like driving a little plastic car like through the pudding or the paint, and then like washing the car, dumping it into a bucket of water. So it's kind of giving the child the control to do it. They have that out and they're having a positive association with getting their hands messy, and they're motivated because it's playful. And then when in doubt, you could also put that new material inside like a plastic bag so that the child can kind of touch it and squish it indirectly without having to get their hands messy, as just like that first introduction. So those are kind of my go-to tips. And giving, kids aren't going to go from like, I hate paint to, oh my gosh, put the paint all over me in like one time doing it. Right. And it is important to work on, because like you said, like when they get older, like art class, like cutting and pasting activities, feeding, meal times, like these, we're going to get our hands messy at some point. You might not love it. But you need to be able to still like function in those scenarios.
Okay, got it. So in terms of that being a red flag, like if you can work up to it, maybe it's just typical, but if you can't get them to do anything ever, even down the road, maybe it's a red flag. Is that a fair assessment?
Yeah, that's pretty fair.
Okay, excellent. All right, let's see where we are. I'm not wearing my glasses. When should my child start coloring? And are some crayons better than others?
Yeah.
Specific.
Yeah. So, coloring and scribbling are two kind of different things, right? Scribbling really can start, as soon as the child isn't like putting crayons in their mouth, right? Or throwing them, or, as long as they're able to like hold a tool. Scribbling can start as early as like 15, 16 months, but I wouldn't expect like really good, controlled, nice scribbles until closer to 2. That being said, and it obviously would be affected by, the child's like interest in coloring. Some kids have like zero interest. In those situations, I would say like, don't underestimate the value of finger painting with something that could be edible and taste safe, because just, working on like those basic scribbles, or just, learning that you can use your hand to do something, like that's kind of an important foundation. And there is like kind of a progression of, just like the random scribbles all over the place versus more of a contained scribble in one area, and eventually getting into what we call the pre-writing strokes. So like a vertical line, a horizontal line, a circle, intersecting lines, and eventually like diagonal lines and more shapes. So if you're trying to get your child to color, don't start writing their name. Like they can't really process that just yet. But those like really basic shapes are helpful to just start introducing, like a shape sorter. There you go. That's like an important like foundation for just understanding like the differences in shapes, hand-eye coordination, rotating the object before you even get to, you know, holding a tool and coloring appropriately.
And is there an age progression or age ranges for each of the things you just said, like the shapes and then the pre-writing?
Yeah. So around 2 would be like vertical line, horizontal line, starting to do a circle. And then 3 would be starting, you know, having kind of mastered those shapes and getting more into intersecting lines, diagonal lines, triangle, more shapes. So kind of like that preschool age, starting to work on shapes.
Mm-hmm. Okay. And so if they're into or beyond preschool and some of those basic things aren't coming together, that could be another, they could have some fine motor issues, or even from what I've been
like visual motor, yeah.
Trunk control issues that make it hard to do the fine motor.
Yes. Yeah. So when your child is coloring, you definitely want to make sure that they're, you know, seated, have good postural control. They're in that 90-90-90 position. Unless maybe they're standing at an easel, that's also great. I love recommending vertical surfaces or slanted surfaces to practice coloring on, because if you think about it, it's right up in front of you. You're able to see what you're doing, and gravity also helps with that like up and down line. And that also helps to kind of put the hand in a more extended wrist position versus like the, you know, flexed wrist kind of coloring, which
sit, right?
Right. Oh yeah. Oh, and Sidewalk Chalk. That's another good one as well. Like that's also an opportunity for coloring. Then I don't think I answered about the crayons.
What type, right? Tools that are better than others?
So I would say, so I always prefer crayons over markers, because crayons have that little bit of resistance when you're coloring. So you're getting that feedback from to tell your body like where you're actually making the marks. Are you pressing hard enough to make a mark? Versus markers and pens are more of like a glide that don't give you that much feedback. And then regular crayons are fine. Most OTs will recommend breaking them in half or even a third the size, because general rule of thumb is the shorter the writing tool, the less chances the child has to hold it totally the wrong way. So we want to eventually work towards like using these 3 fingers for holding a tool, if you think of a mature grasp. But like a typical progression of holding a writing tool would be like that full fist with your thumb up, kind of using more your arm for coloring, and then kind of like an upside down thumb towards the paper, and eventually kind of having more of an open web space with all your fingers, and then progressing towards a more mature grasp with these 3 fingers with your pinky and ring finger kind of flexed into a fist. So that's kind of the typical progression. And as long as the child can hold the tool, I would say, you know, let them try it. You know, there's also like magna doodles, and like the water pens are really popular now too.
And is chunky better than thin, or does it not matter?
Chunky versus thin? I've had good experiences with both. It kind of is dependent on the child. I do like the short and chunky crayons. Skinny is also fine. Whatever it seems like the child is able to hold and sustain that grasp for the length of the coloring activity. And I also would expect the child to be switching hands as they're first learning too, and that's pretty typical.
Okay, good. Yeah, another odd thing that stuck out to me as a mom is my son would apply too much pressure. He would break every crayon or pencil that he used, and again, I thought he was just kind of trying to be difficult as he got older.
He was seeking out more of that feedback.
He was either seeking or he couldn't gauge the pressure that was needed or control it. So just those little things that you're like, that's kind of weird. Why is that still happening? Okay, so that's our crayon question. You kind of touched on this, but any tips for how to progress from that scribbling to, you know, actual coloring skills?
Just a lot of practice. Don't be afraid that your child's going to like color all over the walls, so you're not going to give them any opportunities to color.
But they might, right?
They might. And something, you can set clear rules, like we can color on paper, we can color on this easel, and I would also say like modeling, demonstrating, making it fun, keeping it playful, and like I said, using like gravity, so doing like a vertical surface. You can use something to trace, having your child trace what you draw versus them doing it on their own. That's another good way to practice. So, yeah.
Okay. Excellent. All right. What are some red flags for visual processing issues, and what type of specialists or eye doctor should I seek out to address my concerns? And this parent already knows their child does not need glasses or wear glasses. So I guess that's already been addressed.
Yeah, so visual acuity can be normal, but there still could be something else going on with their vision, related to the child's actual ability to move their eyes together in ways that allow them to read or, keep an object in focus. So these movements, there's a couple different ones. Pursuits is being able to like follow something that's moving slowly. And then saccades is being able to quickly look from one object to the next. So kind of that horizontal or vertical eye movement. And that's what is needed for reading. And then convergence is, if we've all tried following your finger to look at something as it comes closer to you, that is another really important.
Together, right?
Yeah, so your eyes are working together to keep that object in focus. So oftentimes issues with this aren't really picked up until kids start having trouble with reading, because they might get dizzy or tired or lose their place really easily. But some red flags to look for are if the child is like tilting their head a lot or kind of looking at things kind of more with one eye than the other. If they're like rubbing their eyes, seem like they're fatiguing really, really easily with like a visual activity like looking at a book or coloring. If they are kind of squinting, I've also seen like this like kind of wide-eyed, like really intense, like really straining and trying to focus type of expression, or just reporting like feeling dizzy too.
Following with your finger, I know that can be, but not always, a sign. Like using your finger to keep your place.
Yeah. So that's a compensation, right? So kids kind of get away with this type of issue for a while if they're able to kind of figure out, okay, if I just have, my finger or a bookmark or something helping me keep place, then they kind of, they're figured out a way to be able to still do it. And that is actually a really smart thing for kids to figure out. Yeah, that's another good one. So I would recommend for a child like this to see a developmental optometrist who can do a really comprehensive visual assessment of how the eyes are moving, how they're working together, not just the acuity part.
As an optometrist.
Repeat that, sorry.
Not the same as just any optometrist.
Right. So not just like a vision screen, like can you see which line is clearer? Not that type of a doctor. Normally they do recommend you go to one of those first just to see if the child needs glasses. And then they can usually refer you to a developmental optometrist who can do further testing. And sometimes they'll recommend vision therapy, which really trains the eyes to move together the way that they're supposed to.
Yeah, we've been there.
Yeah.
We've needed and had it all. But I know it was hard. I didn't understand who we needed, and it was hard to find. Once I knew we needed a developmental optometrist, it was very hard to find. Even my insurance company was like, we don't know what you're talking about. That's not a thing. And I'm like, well, it's a thing that I've been told to find, so it must be a thing. There aren't that many people in our local area that are that specialized. And I think it's really important for parents to understand that we're not talking about their, like you said, their visual acuity. Like on the vision screening at their pediatrician, they might test fine. My son always did. Issues that they aren't testing for on that test, like you said, how the eyes track, how they work together. It's a little more complicated than your standard vision test.
Right. I've helped families find a good a good eye doctor that can look for this in their area. Usually most like area hospitals will have resources as well. But it's definitely important to tackle because it could be a huge part of why a child might be struggling in school.
Well, and along those same lines, my son he's so fun, also has an auditory processing issue, and the school was testing how well he hears, but that wasn't the problem. He hears fine, so he's going to test fine on your standard hearing test. It was how his brain would process what he was hearing. So it's not like, is it getting into the ear? It's getting past. It's what happens when it gets up here. So It's just important for parents to know that those standard quick screens aren't necessarily going to show the issue. So again, if your gut is telling you like, no, something really like, I feel like he's not getting what I'm saying, but I'm looking right at him and he's hearing me, pay attention to that.
Yeah, absolutely.
Okay, we have a couple left. How can I help my almost 2-year-old manage utensils better? They'll play with them, but they can't scoop yet.
Okay, so playing is definitely a good first step because that's telling me that they're able to hold it and grasp it and not just throw it, right? And I would say at 2, like you would want to see them having like some more regular practice with usually kids master the spoon and scooping first before using a fork, just because it doesn't require as much precision, right? You can kind of just dip a spoon in and get something out of it versus a fork does require more precise hand-eye coordination. So some things I'd recommend, definitely use something that's the kid wants to eat and feed themselves, something that is an easy to scoop material, so something that would stick to a spoon. So that could be like yogurt, pudding, applesauce. This will probably be messy, right? So again, thinking of parents who aren't like crazy about the mess, it is, easier for parents to feed the child and a lot cleaner too. But I like to recommend giving kids that practice. So maybe mom or dad has a turn to like scoop and feed, and then you give a child a turn. So you're kind of co-feeding, like you're working on that together. I would definitely recommend using a utensil that is similar to our writing tool discussion, kind of like shorter, maybe a little chunkier in length, kind of toddler size, versus like that long adult spoon. Also thinking about the size of the bowl of the spoon in proportion to like the child's mouth, making sure that that's going to be, easy and not cumbersome to bring the spoon to the mouth. I've had a lot of success with parents like pre-scooping the food and leaving it in the bowl, trying to encourage the child to pick up the spoon and bring it to their own mouth if they're not able to scoop it just yet.
It's already loaded. They're just lifting
preloaded. Yeah. So that way they're learning, I can use my hands to feed myself this thing that I like eating, versus mom's the only one who can feed me. Or a lot of kids who are very comfortable feeding themselves with their fingers will do that because it's easier than manipulating a tool. So encouraging that practice, even if it's not like the entire meal, right? But kind of that, parent kind of helping and then stepping back and letting the child have a turn and praising them for that. Like, wow, good job. You used your spoon. And you can also practice just the hand-eye coordination of scooping outside of mealtime during play. So like water tables, sandboxes, making a sensory bin by filling up a container with any kind of a dry pasta or rice or beans, scooping with open cups or little measuring scoops or whatever tools you have at home, Play-Doh tools too. Anything that's fun to scoop, or even during bath time, like just bring a spoon in there. You might have your kid like, feeding themselves bath water. But hey, they're like practicing, that motion, that wrist rotation of actually scooping. So yeah, you can certainly practice that just while playing without having the pressure of also feeding yourself.
Okay, awesome. All right, our last one, and then I probably have one or two of my own. How can you help a child tolerate getting their face wet during bath time? Mine freaks out, and it's making evenings really dramatic.
Oh, Yeah, this is a common one, especially during hair washing where, it's pretty unavoidable to get like water near the face, right? And it's not fun to unexpectedly get splashed or even like get shampoo in your eyes, right? So if kids are being dramatic, it could be from this like real fear of like, that was painful that one time that happened, right? So I would definitely recommend having a dry towel or washcloth on hand nearby and kind of helping the child problem solve and like cope if water does get in their face. Like, oh, there's water in your face. We can wipe it away. Here you go. You can do that. Good job. Let's keep playing. I've had some parents literally just put a washcloth over the child's face during hair washing so that they actually feel like more protected and calm. Definitely not just like dumping the water over the face without a warning or a countdown. Right. So giving kids that heads up to know when to expect it. There's also a vestibular component of when you're washing hair, that head tipping back to like rinse shampoo out of the hair. That sudden unexpected head tipping, if the parent is doing that to the child, can be really disorienting if the child's not expecting it or is maybe has some sensitivities with their head position. So that's another thing to consider. But I would say just giving the child as much control as possible. So maybe letting them choose the shampoo or letting them squeeze the shampoo into the parent's hands or onto the washcloth. Giving them as much sense of control over that routine so that they know what to expect and feel a little bit more comfortable with it.
Got it. Okay. Well, those were the questions that were sent in. I just, since I help families with sleep, and understanding what I already understand from our journey about sensory diet, which may not mean anything to anyone watching yet. Can you explain, if a kiddo is a sensory seeker, why would that cause them to have trouble winding down at the end of the day? And how could like a sensory diet right before sleep help? What does all that mean? What does that look like?
Yeah, so you want to be mindful of what you're doing that like hour and a half or so before bedtime. So if you're doing something that is kind of arousing, like running around, playing with the pet, or just something that's going to kind of, increase the child's like energy level. Thinking about like
he's tossing them up in the air.
Right. It's going to be a little bit harder to then like wind down, right? Like if you think about like,
and that's for all of us.
That's for all of us. Like you wouldn't go do like a HIIT cardio workout like 5 minutes before bedtime. Like you would do like a yoga or something like more relaxing. So yeah, definitely being mindful of what is happening right before bedtime and being mindful that the child might need a lot more time to wind down than you would think. So building something like a lotion massage or, having the lights dim, definitely no screen time, like a nice calm environment that can certainly help that transition. And also like if the child is someone who has that lower threshold for being aroused or stimulated by, maybe there's something like a light blinking outside or, the sound of like the neighbor's dog barking. I don't know, something that, isn't, especially those like unexpected sounds. I definitely like recommending from my personal experience, having that like kind of constant background white noise to kind of help the child just, drown all the other information out to help wind down.
Yeah. And then conversely, some kids have that low or I guess high threshold and they're going to need certain types of touch or compression or whatever right before sleep to like, to get the wiggles out is like an easy way to think of it, like to really be able to come down to that calmer level.
Yeah. So generally that like prolonged deep pressure is going to be more calming for kids, and something like a tickle that's like light touch is going to be more like arousing and getting kids like excited. So yeah, like no tickles before bedtime, but like nice big hugs and massage, go for it. Another thing that's nice to do before bedtime too, like you had mentioned before, your son being really calm after swinging. So kind of like that linear back and forth, like there's a reason why Rocking chairs are
spinning, right? Spinning is
so
arousing.
spinning is more excitatory, right? Like you're gonna get dizzy and then you're feeling kind of silly. So yeah, not spinning, no like ring around the rosy or anything like that, but like a gentle rocking back and forth in a rocking chair. If you're lucky enough to have a swing at home, or can do some kind of a like back and forth, like row your boat kind of activity, something like that can be more calming as well. Definitely no spinning.
Right. We're thinking of like organizing.
Organizing movement, yes. So linear, nice and
like
organizing.
A concert and you feel really wired.
Yeah, we're not jumping. We're not jumping. We're not spinning. We are like swaying and rocking, and maybe with a song.
Right. Love it. Okay. And then the last thing I'd love you to touch on is just pottying. So, sometimes potty training goes well right off the bat. Some kids get stuck in the process for a year or two, and families are stuck along with them. And I suspect that a lot of them have some issues that could be best addressed by an OT like yourself. So what are some things that kids can struggle with that could make graduating from the potty process just harder than it needs to be, or just not possible, that are, OT related?
Yeah, I'm so glad that we're ending with this question, because I'm realizing I did say there were 8 senses, and I've gone over, the 5 ones we know, and then the 2 for, yeah, so there's that one last tricky sense called interoception, and that is so related to potty training. So interoception is when you have that internal awareness, do you need to go to the bathroom? Are you hungry? Are you cold? Are you full? Are you about to get sick? All of these like internal, like it's information from your organs and everything that's happening inside of you, how to then understand like what that means for you and what you should do about it. So yeah, with potty training, being able to sense, like, is my diaper wet? Is my diaper dry? Being able to tell that without seeing the diaper, but to just be able to feel that, that could be something that kids might be struggling with. And then obviously like knowing before you've gone, is that something that they're able to verbalize or feel or sense? So that interoception sense, it's very difficult to change. But I would recommend that parents build language around what these things are, and also use other senses to help compensate. So actually, giving the language of like, oh, your diaper's full, or oh, your diaper's dry. And, let's go check and see, does it feel wet? Does it feel dry? So then you're bringing in vision. As long as that is not impaired, you're able to use that to kind of, to show the child, yep, this is what wet feels like, or this is what dry feels like. So that's one thing you can try. With potty training in general too, I know we've talked a little bit about that, like sensitivity to getting your hands messy. So that can be a fear I've seen with kids, like not wanting to wipe.
A release, right? Some kids really struggle with that sensation of
Yes, that is a sensation, right? Maybe they have like a bad experience with, a rash, or, it's uncomfortable, or there's a lot of sensations happening just with the process of going to the bathroom too, before you even get into wiping. So something that OTs can help with potty training is, aside from the sensory part of it, is just getting into that really, really good, consistent routine, the clothing management piece of it, and, what are the steps? Can we tolerate just sitting on the potty? We did a post about potty training tips with Play at Home, and one of my favorite ones is making sure kids' feet aren't like dangling up in the air, that they have like something to put their feet down onto so they feel more grounded and comfortable. Being aware of, if you go out in public to use the bathroom versus at home, kind of like the unexpectedness of, another bathroom that you're not used to. The sound of the flusher, the sound of like the automatic hand dryers in public restrooms, a lot of things sensory that can be like really, really overwhelming, and make this process that might already be challenging even harder.
Yeah, exactly. Okay, good. Well, that was super, super helpful. And I hope, I mean, for me, but I hope for everybody else too. The last thing I'd love for you to address is like, what does this look like? Do families need to be intimidated or scared to reach out for an OT evaluation? Do they have to
No.
the child's going
Yeah.
to do treatment for the rest of their
No,
lives?
not at all. OTs can help.
You can keep going there.
Yeah, you referred to a sensory diet, so that's when OTs do a good assessment of a child's sensory needs and help parents to come up with some activities or accommodations to do throughout the day at specific times to help the child function at the best that they can. So that doesn't necessarily require like weekly treatment for weeks and weeks on end. That can be an evaluation and a conversation and observation of the child and kind of working with the parents to come up with something that makes sense. So like for the kid that can't sit still, they might need to do some jumping jacks or animal walks or like a little bit of a workout before they can be expected to sit down and do their homework for 30 minutes, right? Or they might need, maybe they want to lay down on the floor and do their homework, or maybe they want to sit on an exercise ball and bounce a little bit while they do their homework.
And that's where I think someone like yourself is so valuable. This can be really overwhelming for parents, even for like, let's say it was you with your child. You might even find it overwhelming and you're much more informed, right? So it's just, every kiddo is so individual that coming up with that sensory diet, it really needs to be customized, I think, to,
Yeah. It's not one size fits all by any means. Something that, yeah.
Or go to a website. I mean, I tried to do it myself, but we really needed someone to look just at him and follow him and through trial and error say, this is going to be stimulating, this is going to be calming, this is what you do if you want him to sit for homework, and this is what you do if it's for sleep or whatever.
Right.
So that's where I think the value really comes from a person working, one-on-one with your kiddo and the home environment, the fact that you do it there, that's awesome. Because you really get to see where it's impacting their daily functioning and help the families with that. I know that, it's not super helpful to say like, try these 30 things over the next week. That's a lot for a parent. So just having somebody kind of guide you through, there is no one size fits all. It's what does your kiddo need and what do they need in all these different scenarios.
Right. Yeah. And there shouldn't be like a buildup or any kind of stigma about this. Like I said, when we first started, we all have our sensory preferences, things that we enjoy, things that we could do without, and things that help us to cope and, maybe sit and stare at a screen for like telehealth or virtual school all day. Right. So it's just taking that individualized approach is where OT's role really, really comes into play, and kind of analyzing what are some things that actually could work with your family's routine that maybe aren't super hard or out of the way to do, but can have a really positive impact.
Awesome. Wonderful. I think probably the biggest takeaway is what you're noticing impacting, like really impacting some functioning in your child's daily life.
Yeah. If you're struggling, if there's if you're not able to regroup and cope and continue with the art class, right? Or if there's something in your gut is telling you that there's this something going on that you want to just get assessed and looked a little bit more into, then I would say,
is you find out it's typical age-appropriate behavior and everybody goes on.
Yeah, and then you have peace of mind and it's like, okay, cool. Yeah, my child spins in circles on occasion. That's normal. Okay, fine.
The best that happens is you get, awesome support that makes future milestones easier, school easier, life easier, and that's really, really important. And just the family dynamic and family sanity.
Yes, which cannot be underestimated.
Awesome. Wonderful. Well, this was so great. Thank you so much for taking the time. I do not see any additional questions in our comments, so I think we can go ahead and wrap it up. I guess finally, remind families where they can find you and find Play at Home.
Yeah, so Play at Home is on Instagram. There we have a website. We have several OTs around the Philadelphia area who are happy to evaluate your child if you have any concerns about what we discussed today. I don't think I'm missing anything.
No,
Staff can chime in or comment if I'm missing something.
Well, that's the only thing I add is Play at Home also offers, in-home physical therapy.
Yes, PT and OT.
Yeah, and if anyone missed that live, you can catch it on the replay on our IGTV channel. We had Stephanie come and chat. All right, well, I think that's good for today. Thanks to everybody who joined. I know this one was a little longer, but it's something I'm super passionate about, so I wanted to give it its fair amount of time. And thank you, Alyssa, for making the time. And I hope to see everybody back here for our next live, which will be Monday night at 8 p.m. as per usual, with Safer Babies, talking about child-proofing and how to make your home safe for your babies and your children. And hopefully we'll see everybody back then.
Thank you so much.
Yeah, thank you for joining. Have a great rest of your day. All right, bye-bye.
Bye.